The word corona was once beautiful. It came from the Latin language meaning crown, a glowing ring of light around the sun during an eclipse. For centuries, it symbolized brilliance and power. No one imagined that one day this peaceful word would become one of the most feared names on Earth. But in 2019, a crown of light turned into the crown of a virus small, invisible, but strong enough to stop the world. The story began quietly in a region of China when a few people developed a strange pneumonia. At first, it seemed like a local health issue, nothing more. But the virus they carried had a secret. It could spread before symptoms appeared. It jumped from one person to another silently, hidden behind normal coughs, simple handshakes, crowded gatherings, shared surfaces, and even laughter. Scientists discovered that this new virus belonged to the coronavirus family, named after its crown-shaped spikes. It was officially called SARS-CoV-2, and the disease it caused became known as COVID-19. None of us were prepared. The early symptoms were mild and confusing. A little fever, a persistent cough, body aches, loss of taste and smell. But then came the cases where the virus attacked the lungs so intensely that breathing felt like trying to inhale through a blocked straw. In some people, oxygen levels dropped quickly, turning a normal day into a medical emergency. Health workers noticed that the virus behaves differently in different bodies. Young, healthy people often recovered easily, sometimes even without realizing they had been infected. But older adults, especially those above 60, suffered more severely. People with diabetes, high blood pressure, heart disease, lung disease, kidney problems, cancer, and weak immunity were at the highest risk. Gender played a role too. Men were more likely to suffer serious complications. Even region and climate impacted spread. Cold, crowded areas saw faster transmission. Many poor countries suffered more because their hospitals lacked equipment, oxygen cylinders, ventilators, and trained staff. Death ratios varied across the world. In some countries, like Italy and the US, early waves were devastating. In others, strong early lockdowns kept numbers low. But almost every region eventually faced its own storm. The virus did not follow borders, religion, language, or politics. It followed people wherever they moved. It moved with them. Suddenly, traveling became dangerous. Cities fell silent, schools closed, jobs shifted online. And the world experienced something it had never seen before: isolation on a global scale. Doctors and nurses became warriors dressed in masks, shields, and PPE suits. For months, they worked without rest, without seeing their families, sometimes without proper protective equipment. Many lost their own lives while saving others. Inside hospitals, scenes were heartbreaking. Patients waved goodbye through video calls. Families prayed outside the gates. Healthcare systems collapsed under pressure. Medicines ran short. Oxygen became more valuable than gold. Treatment at the beginning was uncertain. There was no cure. Doctors used what they had: fever reducers, oxygen support, antibiotics for secondary infections, and sometimes ventilators. As knowledge improved, medicines like remdesivir, dexamethasone, and monoclonal antibodies were introduced. Plasma therapy helped in some cases, but not all. The world waited desperately for something stronger: a vaccine. Scientists worked day and night, breaking the record for the fastest vaccine development in history. Within a year, the first vaccines were ready. Pfizer, Moderna, AstraZeneca, Sinopharm, Sputnik, Johnson & Johnson. Countries fought to secure doses. People stood in long lines at vaccination centers. Some were afraid, some were confused, and some were relieved. But slowly, millions of people were vaccinated. Immunity began to grow like a shield around the world. Prevention remained the greatest weapon. Washing hands, wearing masks, avoiding crowds, staying home, keeping distance — these simple actions saved millions of lives. For the first time, humans realized how powerful everyday habits could be. Streets that were once packed with traffic became empty. markets turned into ghost towns. Mosques, churches, temples, and schools closed their doors. Festivals were canceled. Friends and families met through screens. Life changed, and the world learned how much it had taken normal days for granted. In this battle, one organization stood at the center: the World Health Organization. The WHO guided governments with warnings, research, recommendations, and safety rules. They provided updates on symptoms, variants, travel restrictions, and treatments. They helped poor nations get vaccines and protective equipment. Sometimes people criticized them, sometimes praised them, but throughout the pandemic, the world listened to their voice because uncertainty was everywhere. Variants of the virus appeared: Delta, Beta, Delta, Omicron, each wave, reminding humanity that the fight was not yet over. But by now, the world was stronger. Hospitals were better prepared. Doctors had more experience, vaccines reduced deaths, and communities became more aware. People started returning to work. Schools reopened, and life moved slowly toward normal. However, something important remained: the lessons. Corona, the disease named after a shining crown, taught humanity that even the smallest organism can shake the largest nations. It showed that health systems matter, scientific research matters, and cooperation among countries is essential. It exposed inequalities: how poor people, crowded areas, and weak healthcare systems suffer first. It also showed that age, gender, and pre-existing diseases can transform a simple infection into a deadly threat. But above all, it proved that humans can adapt, survive, and rise again. As the world heals, a final chapter emerges: quiet, powerful, and hopeful. The virus may have brought fear, distance, and pain, but it also brought courage, unity, and innovation. It reminded everyone that life is fragile and precious, that a simple breath is a blessing, that heroes are not only in movies, they are doctors, nurses, delivery workers, teachers, scientists, and even ordinary people who stayed home to keep others safe. And so the story ends not with darkness, but with a new understanding. Corona took many lives, but it also awakened humanity. It forced the world to slow down, to rethink, to appreciate connection, and to prepare better for the future. The crown of the virus has faded, but the crown of human strength shines brighter than ever. In the end, the virus did not win. Humanity did.